this conversation this afternoon on bridging the supply chain gap to deliver resilience. The pandemic has really laid bare the extent of the health equity gap between more developed and less developed nations. As stated by Mark Sussman, CEO of the Bill and Melinda Gates Foundation, there was a vision early on to make COVID-19 the first global health crisis dealt with equitably. We can now say that vision has failed, he said. However, with countries in Africa in particular, acute need of vaccines and other medical supplies, pharmaceutical companies and NGOs are rising to the challenge, outlining a range of measures to provide vital life-saving vaccines and medicines at cost price or below, despite long-standing medical infrastructure challenges. But there is a need to ensure that delivery of vital supplies can really be fulfilled. It's in this context that countries like Qatar can demonstrate even greater effectiveness in supply chain resilience, thereby helping to bridge the global health equity gap. To discuss all of this and more, I am delighted to welcome to you our very esteemed panel, starting with Her Excellency Samia Suluhu Hassan, President of Tanzania. If you could please join me here on the stage. Thank you so much. We'll also be joined by Dr. Emma Hannay, who is a public health doctor with a focus on global health strategy and delivery. She works for an organization called FIND, the Global Alliance for Diagnostics, where she's been leading their COVID response. And we're also joined by Mr. Lim Meng Hui, who is CEO of the Qatar Free Zones Authority, which was established to regulate free zones in the state of Qatar here. We're also hoping to be joined by Jean-Paul Choya, who is from Sanofi, the pharmaceutical and healthcare company, who is running a little bit late, but hopefully he will be joining us soon. So thank you to all our panel for joining us here. Thank you here to the audience. Before we start with questions here on the stage, I just want to remind the audience that this is really an opportunity for you to ask your questions. So please, when the time comes, do raise your hand and a microphone will hopefully find you. If you would rather not ask your question out loud, you'll see the QR code on the big screen behind us. You can scan that from your telephones wherever you're sitting here, and you will be able to submit your questions via the app. Talking of which, for those of you who are watching us on the live stream, you are not forgotten. Please do ask your questions, submit them through the app. You can type them in the chat box. But firstly then, some questions from myself to our panelists. And Your Excellency Samia, to start, we'd really appreciate your overview and thoughts on how countries like Tanzania should be better integrated into the supply chain.
Thank you very much, Madam Moderator. A country like Tanzania, to be better impacted in the supply chain, we should first look at the supply chain. In order to have a better supply chain, I think the country has to have extensive network on systems and then components and processes. But then as you look at the system, country not only Tanzania, but country like Tanzania, I think most of us are still using the manual system in operationalizing the distribution and provision of medicine and healthcare services to patients. So we need to be first supported on systems to be having better systems that can quantify the requirements, the correct requirement from bottom up to the national level. We should know exactly what are the requirements, one. But two, we should have the proper transportation, transmission, distribution of the healthcare services, but also medicine, of which, if you go to our countries, looking to most of the African countries, the distribution is limited by so many factors, maybe type of roads, but again, the system of distribution itself, it's limited to so many factors. Then provision of the medicines and healthcare services to most of the patients depends on the health insurance processes or systems. Those who do have health insurance are likely to benefit on the health services and maybe getting most of the medicines required. But those who don't have it, those who depend on government subsidies, our capacities to deliver, our capacities to serve those who are exempted from the health services is very limited. So to impart countries like Tanzania in a supply chain and bridging the gap, we have first to be supported on those three. Systems, processes, and distribution. Yeah.
Thank you very much indeed for starting off this discussion. And Dr. Emma Hannay, you work for this organization, FIND, which is a global non-profit organization which seeks to drive innovation in the development and delivery of simple-to-use diagnostics to combat major diseases that affect the world's poorest populations. And we were hearing there about manual systems still being used, so innovation is so important. When we look specifically at the rapid diagnostic tests, which became and still are crucial for enabling people to detect the virus, what were the challenges, firstly, in manufacturing them in such great capacities, and secondly, their distribution? Was distribution equitable?
It's somewhat of a leading question. And thank you all, and I think Her Excellency summed up some of those systems challenges that we see in diagnostics really well, because obviously they're part and parcel of the health system and cannot be divorced from it. I think in COVID diagnostics, we saw an absolute triumph of science. So within the course of a couple of weeks from when COVID was first reported to WHO at the end of December, we had the full genetic profile of the virus. By February, there was WHO able to ship PCR testing reagents around the world. So central reference labs in every country were able to do COVID testing. In other diseases, to give you an example, that can take years, even decades to do. So a real triumph of science. And that triumph of science was then followed by a tragedy of access when it came to getting that testing from central reference laboratories to every health center and every hospital that needed COVID testing, especially as the worst of the pandemic hit. And actually that's where rapid tests play a critical role, because there are tests that you can move right to where patients are in the community versus other testing, which is sort of part of a wider arsenal which has additional complications to it. So PCR testing, for example, that has to be done in a laboratory. One of the things that COVID really revealed was how convoluted and fragile some of our supply chains are. So, for example, for all COVID tests, including rapid tests, you need a swab to be able to take a sample, which I think we're probably all now very intimately familiar with that process. At the start of the pandemic, the vast majority of swabs in the world were produced in just 2 factories, one of which was in Lombardy, which was first hit by the pandemic, as you remember, and that factory was shut down. Absolutely. The other of which was in the US, which then put export restrictions on those swabs. So I think the pandemic really revealed how convoluted and fragile the supply chains for COVID diagnostics were. And that's really at the global level. When it then came down to country equity issues, what we saw was high-income countries able to move fast in procuring and securing supply of diagnostic tests, but also to be able to understand how to use those tests in different circumstances. So where did they fit best? What did it mean to use a rapid test versus a PCR test? Grappling with these questions of science in real time and in public. And that was a really complicated period for many countries to be able to generate their own evidence on how to use tests and then deploy them rapidly within their health system. And we saw significant inequity during this period of high-income countries able to move quickly to be able to deploy those rapid tests quickly through their health system, a tool really designed for low-middle-income country health settings, whereas the countries that they were designed to reach the best were least able to access those testing. And that was because of issues around understanding how to use these tests, issues of financing, issues of supply chain. One of the things that we think is particularly important and lessons coming out from COVID is how centralized manufacturing does not lead to supply chain resilience. So we saw the first couple of rapid tests for COVID produced from the same country, which was a period where certainly a few of us would wake with cold sweats in the middle of the night that potentially the supply chain from South Korea would be affected in some way. We now have rapid tests manufactured in new areas, including a number of areas and countries on the continent of Africa, which is fantastic. And so we think that that has to be part and parcel of future pandemic preparedness and supply chain resiliency, is to disseminate the manufacturing base and to link that through to access to basic testing throughout the healthcare system.
Emma, thank you so much. Is decentralization something that our other guests would like to see? Before I come back to you, Your Excellency, if we maybe can hear from Mr. Lim Menghui first. Talk to us about your thoughts on decentralization and also about the challenges here in Qatar during the pandemic and how the Qatar Free Zones Authority, which you lead as CEO, supported businesses and institutions.
Thank you. It's my pleasure to be here for this event. And I think all of us have lived through a momentous period during COVID. And what we saw was a significant disruption to the supply chains, obviously. I think we saw that, there was insufficient supply in the basic masks, oxygen tank issues, and later vaccines. And even when these things were produced in sufficient amounts, they couldn't get to where these were needed. And earlier, I think after the people started to come back to the offices, then we saw the reverse situation whereby you had a supply chain crunch. Not enough ships, not enough containers, and the prices went sky high, multifold. Only now they're starting to come down. And this causes a serious issue for affordability, access to these basic healthcare solutions, not just for developed countries, but especially for developing nations. And I think this is something that we are glad that I think Qatar was fortunate to be able to play a role to alleviate some of this during COVID. I'll just share some examples. We have Qatar Airways, and it was significant that during the whole COVID period, I think they're probably one of the only airlines that continued to fly their planes without stopping. And they converted many of the passenger flights into cargo planes. So I think throughout the COVID period, we were doing about flying to 80 destinations non-stop. And of course, some examples, we initially, for example, sent supplies to China because it originally badly hit. And eventually, we were taking the supplies out of China, the masks, to the rest of the world in the reverse direction. And particularly in the case of Africa, Qatar actually played a major role to deliver the vaccines to Africa. In fact, if you compare the number of destinations before COVID, we've increased by 8 destinations to 26 destinations in Africa post-COVID. So continued focus to extend the connectivity to the African continent. And some other examples, besides just flying to these locations, Qatar Airways and Qatar has taken direct stake. For example, in the case of Rwanda, we have taken a stake in the national carrier as well as a stake in the airport to help to strengthen the transport connectivity nodes as well as air carriers, so that we can have this continued resilience in the supply chain. And finally, coming to the free zone itself, we are located right next. We have two free zones, one next to the airport, one next to the seaport. So these are bonded zones. So obviously, our target initially was to attract these logistics 3PLs, top 3PLs to set up in our free zones. And fortunately for us, right when COVID hit, one of our very first, we are a new zone, by the way. One of our first investors was GWC, which is a very big logistics player here. And they opened up their factory, their warehouse at the end of 2020. We're right in the midst of COVID, with about 6,000 square meters of cold chain facilities from 0 to ambient temperatures. And together with their partners, UPS, we were able to bring in COVID vaccines within the same day. I remember that time the first shipment was from Brussels to Qatar within the same day, and subsequently from Qatar to be redistributed to the region. So we were fortunate to be able to play a role during the time of a crisis, and we continue to emphasize the traction of logistics transport operators to set up a regional base in our free zones, so that we can contribute to the supply chains in the region. But going forward, I think, as highlighted by the earlier speaker, I think when we started with COVID, a lot of the production of the medical supplies were very concentrated in one or two locations, which is it becomes very dangerous when you have emergency needs. So I think going forward, we see a move towards distribution in terms of production bases, as well as logistics distribution bases. Of course, the final end goal is best if these production can be right in the location where it's most needed, but you need time to miniaturize the processes, to engineer the solutions. That takes time. In the meantime, I think rather than having just one or two locations, we would like to play a role for some of the medical equipment, as well as suppliers to set up in our free zone, so that from the free zone they can more easily distribute to the region, especially to Africa. And meet the needs, the more ready needs of the people. And I think this is critical when you have an epidemic like the pandemic, like the COVID. Any time that you save, you're saving lives, and you're increasing lifespans of people. So I think this is critical.
Thank you very much, Mr. Lim. Your Excellency, do you think decentralization then is the way forward? Do you think this would have made a difference for Tanzania?
Yeah, I think so, because if the manufacturing companies would do the decentralization and produce in our places, it's going to reduce cost and improve efficiency of distribution of the healthcare services. And I was thinking, the other area is, apart from decentralization of manufacturing, improving the local innovations. Because during COVID, during Ebola attacks, most of the African countries are using the local innovations. So we have to have scientists working with us, improve the local innovations. Because it's local, it's easier to improve it and distribute it to the people. But again, when it is locally made and the community believes that it's there, it's easier to use it. It's easier to accept the technology rather than waiting for the engineered technology from somewhere and then be put to the country. So decentralization of manufacturing is going to help a lot.
And you talk about local innovations. Can you, either of you, give us some ideas about what that would look like? Is this something Dr. Emma can help us with?
Happy to start. I'm sure Minka will add some comments on at the end. So at FIND, we've been doing work to expand manufacturing to Africa before COVID. for different reasons, and I think Her Excellency alluded to these, which was largely around the fact that manufacturing products that are most fit for purpose is easiest when you're closest to the communities that they're designed to target. So for diseases like neglected tropical diseases, for example, where there may be little interest from global manufacturers who manufacture at high volume, there's a lot of interest in a country that's afflicted by those diseases. Producing diagnostics that are appropriate for local conditions, so perhaps can do temperatures that are higher than you might see in other countries, where the instructions for use are relevant and for local communities. Those sorts of things are much easier close to where communities are. It is a hard topic, though, to divorce from basic questions on access. So one of the things that we've seen challenging for diagnostics is that availability of basic diagnostic tests in most health systems, and I'm talking pregnancy tests, malaria tests, blood glucose tests, the basics at primary care centres, are largely absent. In fact, the Lancet Commission on Diagnostics showed that only about a third of most primary care centres in low middle income countries have a basic diagnostics available. And so connecting up that access agenda through ministries of health, through ministries of finance and planning on questions of local manufacturing and economic development is critical. It really has to be a whole of government response to be effective.
Thank you, Dr. Emma. And Your Excellency, when you became president, you said amongst your many priorities was to build thousands of health clinics and schools and seek assistance in improving public health partnerships. So exactly what Dr. Emma was alluding to, you were trying to improve the likes of diagnostics within communities.
Yeah, that's true, that's true. And it helped a lot. It helped a lot because you might find there is certain knowledge within the certain areas, but then the government hasn't provided what is necessary for that knowledge to be known, for that knowledge to function. So by constructing a lot of dispensaries and health centers and providing them with healthcare equipment, they impart the science and what they think they know together to find the healthcare solutions. So that's correct, yeah.
But you really need the supply chain to be working for them to be effective. Yes. Yeah, absolutely.
Yes.
Thank you so much for those initial thoughts about the supply chain gap issue. We'd love to open up to the audience. Great to see some hands up already. Could we get a microphone firstly to the gentleman in that second row? Thank you. Could you let us know who you'd like to direct your question to, please?
Yeah, I'd like to direct it to the lady here. My question is, when you're elaborating on the issue of local innovation, you quickly switch back to local manufacturing. I'd like to re-emphasize that again. I mean, Africa, for example, is home to some specific diseases like, for example, Ebola or whatever. Could, for example, R&D centers be located in Africa? Could we respect, instead of doing all the actual research and development, all the intellectual stuff centrally, and then do the manufacturing in a decentralized fashion, is it possible to decentralize knowledge? And is it possible to build capability, genuine, for the full cycle in areas and support them that way? Thank you. Is that realistic?
Absolutely, at least in the space I work in, which is the one I can talk to most concretely. So when we talk about diagnostics, there's a sort of manufacturing maturity scale that goes from assembling, packaged goods through to manufacturing raw ingredients, through to R&D. There's a very traditional funnel for those things you think about maturity. COVID turned that on its head, and I can use examples from the continent to show that. So companies like Mintech out of South Africa, who actually came from a mining and R&D background, came in through the R&D side and learned how to manufacture. So they turned that funnel on its head when it came to COVID diagnostic testing in the continent. a number of agencies, like folks like Henry, folks like Institut Pasteur Dakar, have played critical roles in the development of diagnostic testing. And a number of laboratories and institutes through the continent, beyond the manufacturing side, have played really essential roles in generating evidence on how to use tests, in validating how tests perform. So I think COVID poses a pretty good opportunity, a small silver lining of COVID, which otherwise, as we know, is a pretty grey cloud, is that we can turn that innovation cycle on its head. We don't have to start from the basics and work through each step to the more complicated R&D side. There's an opportunity to create a more vibrant ecosystem, especially for the diseases that most affect communities, where there is a significant gap. Areas like neglected tropical diseases have led the way there because it's largely affected communities on the continent, and researchers have led the way there. But that doesn't mean it has to be limited to that. Other key diseases, tuberculosis, HIV, or non-communicable diseases, I think we can see, hopefully, that same pattern repeated.
Thank you, Dr. Hannay, and thank you for your question. We had a question from Dr. Ricardo Leite from Portugal.
Hello, thank you for the panel. I'm a member of Parliament from Portugal and the president of Unite, network of parliamentarians from across the world in more than 85 countries. We're currently part of the negotiation process of the Pandemic Treaty, which of course will upgrade the international health regulations to hopefully to make the world better prepared and to prevent and prepare and respond to future pandemics. In that sense, focusing on what you are doing, what should be included in such a treaty when it comes to decentralization and to regulations and boundaries that need to be taken down to make sure that we are more effective, looking at that multilateral coordinating body that the treaty will, in a way, enforce? Thank you.
Your Excellency, would you like to answer?
Yeah, for me, maybe I should. I'm thinking of, in the case of developing world, I'm thinking of, in order to be able to foresee the dangers of the coming calamities, I think we have to have the capability and capacity of first foreseeing the knowledge to foresee what is coming. But again, we have to have the capability of absorbing and adapting the shocks of the calamities which we are thinking it's coming. Because it starts in certain areas, then you're hearing that this calamity is happening somewhere. For us is to have the capability of absorbing and adapting the shocks, and then to institute the changes in our structures. But unfortunately, most of us, we don't have that capability. So in order for the whole world to be on the same path in foreseeing what is coming, and the world to get ready for the calamities to come, we all have to work together in those areas. Well, we have to be able to foresee, and those who will be able to foresee to tell others that this is coming. And then those who are receiving the information, be ready to absorb that shock and be able quickly to change the structures that could accommodate the coming calamity, that could be able to treat or to work on the coming calamity. And otherwise, as you saw in the case of COVID, I think the whole world was caught unprepared. Unprepared because those who could forecast didn't tell the rest of the world that this is coming and we have to do this, that, and that to be prepared to receive the shock and change the structure so that we can all work together and fight the calamity. We didn't have that.
And that idea of sharing information on an international level is something that I have heard time and time again during this WISH conference. So it's definitely one of the big themes coming out of this conference. And improved data analytics, and we've got a panel coming up this afternoon that I'm chairing about data use and how it really drove response to the
Yes.
pandemic.
Yes.
That data, the sharing of that
Yes.
data, so
Yes.
important. But as you say, that anticipation.
Yes. And maybe one more point is that we shouldn't use pandemics, turn it into trade. Because pandemics are pandemics. They hurt everybody. So we shouldn't use as trade, trading the what? The knowledge, the service to the world. Otherwise, it's not going to work, and the pandemics, they are going to swipe the world if we all don't work together. Yeah.
Thank you, Your Excellency. Thank you, Dr. Ricardo, for your thoughts and your question. Please, to anyone who is watching us live online, please do submit any questions for the panel. In the meantime, we will take another one from the audience down here. If we could get a microphone here, please, to anyone with their hands up. Thank you. If you could let us know who you are directing your question to. Thanks.
Okay, my name is Omar Buguyu. I'm from Tanzania. I'm the Director of Curative Services from Tanzania. My question goes to our colleagues from Qatar. In my own perspective, one of the biggest challenge in building the resilience in health system and probably in other sector is overly dependent on the West. Most of the ideas, most of the time we are waiting ideas from the West. And it is very unfortunately, again, when the ideas coming outside of the West, people are doubting or sometimes they are condemning those ideas. So I want to learn from the colleagues from Qatar. You had different ideas from the rest of the world, and you managed to survive. That we've learned it yesterday and today. We've seen that Qatar, you've done wonderful during this pandemic, and you get out of it as a champions in resilience, especially on trade and on health services. So what was your experiences during the pandemic? How did you manage to penetrate regardless of the perceived knowledge that it has to come from the West, but this was generated from your own? So what is your experience? Again, how did you manage to do whatever that you've done?
Thank you. Mr. Lim, would you like to take that, as he's looking for an angle from Qatar, and you were very much present here. So it was about the fact that so often knowledge and action is driven from the West, but Qatar is, and this whole region had really managed the pandemic very well. So some more thoughts on that. I know you gave us an oversight before about how Qatar managed. Can you expand that thinking about maybe independent thinking within the region and not relying on the West?
I think my perspective comes more from the supply chain area rather than from health policy. But I think we could see when COVID started, everybody was in a shock. How do you manage the situation? But we could see that slowly there were models coming up in different countries, and I felt that the adoption was pretty fast. I mean, different approaches. For example, who do you allow to come into your country? How long do you quarantine and all these things? I thought these were piloted maybe in this nation, that nation, and quickly it was adopted across the board. In our case, I think what Qatar was determined to do was, in the case of like I said, in terms of the flights, I think most nations, most air carriers shuttered their planes. They were grounded. But Qatar decided just to go ahead and be different, and we kept our planes flying. Because
and the ports were kept open
yes,
as well.
the ports also. So I think that this was critical, because if everybody is not flying, then how are the goods going to get from place to place? This is not just for Qatar. This is for the whole world, right? Because Qatar flies global flights. So I think that was one thing that Qatar did different. They went against the tide, and they kept things going. continue to contribute to this, what do you call, the supply chain resilience. I think without this, I think things may have been a lot worse. Yeah.
So in that situation, instead of just following suit and following what the West was doing and other areas of the world, it was that independent, logical thinking. If we shut down, then the whole supply chain is going to really shut down. So that independent thinking, yeah. Thank you, that was a really interesting question. Thank you for that. Any more questions here in the audience? We've got some hands up over there in the middle section. Please let us know who you would like to direct your question to.
I'll direct the question to the whole panel. I think the biggest issue with decentralization is dependency. There's a sense of dependency in most African countries in terms of innovation, in terms of goods that are created. And I think that came to show when there was a crippling effect during COVID. So when we discussed decentralization, what steps have we taken that can lead to less dependency in the future and allow for African countries to become less to be producers of what, if any other pandemic happens, how can we deal with that?
Dr. Hannah, you were mentioning some hubs in Africa where manufacturing is taking place, I think.
Absolutely, and I think in Africa, although I'd love Her Excellency's perspective on this, I think you saw the most joined up regional response out of all of the regions in the world with, really critical leadership from key countries, from the Africa CDC and others, allowing the continent to speak with one voice, at least on a global stage, in a way that other areas really struggle to. And I can tell you that other regions in the world often look to that as an example of how perhaps from a public health perspective they can come together as well. I think that question on decentralization and what that means for countries and health systems is a perhaps key challenge of our times. And so to separate the sort of ideology from the practical piece, one of the things we know for diagnostics is the closer we move diagnostics to patients, the more access they do have and the more equitable that access is. So with COVID testing, our friends at CHAI, the Clinton Health Access Initiative, did a survey in 7 countries, and they showed that PCR testing was done twice as often for men as it was for women. But when you look at rapid testing, the access was pretty much 50-50. So that access gap moved away because you're starting to move the test closer to health centers and other resources where women are, as opposed to more centralized laboratories. One of the challenges of decentralization, which others on the panel, including Her Excellency, can speak to more easily, is it's a real supply chain challenge for countries to be able to move resources, things like tests and medicines, out reliably and consistently right to the end of the supply chain to really get that last mile right and to get visibility on it. And Her Excellency spoke about that need to get a bird's eye view across the system and real quantifiable data. That's a challenge for every multinational company, and it's twice the challenge when it comes to remote health centers. But things like digital innovation, and I know there's a panel on this later, have the potential to really help us there. Because without that visibility, you do get neglect and dependence in the system.
Your Excellency, would you like to add?
Yeah, on my side, I think no one likes to depend on somebody else. But it's because of lack of knowledge and technology. Yeah, we might be having some knowledge because we're attending universities and medical schools just like others do, but lack of technology. There should be technology transfer from the advanced countries to the developing countries, and we should work together in that because we might be knowing what we want, we might be knowing how to do it, but we don't have the technologies. There might be technical know-how, but no technologies. So I think transfer of technology is another factor for us to get away from dependency. Yeah.
Thank you very much, Your Excellency. And on that question and about whether Africa should be beginning to be more of its own hub, when we look at decentralization, is it fair to say that Africa can rely on areas like here, the Gulf, as a major hub? So it is decentralized from other areas, China, Korea, but it doesn't necessarily have to all stem and come from within Africa. So it's just looking at that supply chain differently and where the hubs are. Thank you. Yes, we had another hand up.
Hi, thank you. Dr. Jody Sherman from the Yale Center on Climate Change and Health. This is a question for the entire panel and has both innovation policy dimensions. It has to do with the similarities of the challenges of dealing with a pandemic and the climate crisis, and that they have similarities in terms of risks and opportunities for building resilience and decarbonization at the same time. What I have not heard discussed thus far is the need to move more toward reusable medical devices, for innovations to make them modular, circular in design so that they can be disassembled, safely cleaned and reassembled, and also policies to drive businesses in that direction, as well as education for how to safely use and clean. And so it's a question for the entire panel, how you would see or how you're thinking about how to address these challenges. Thank you.
Thank you, Dr. Jody, and I'm looking forward to talking to you on our panel tomorrow morning about waste management in hospitals. So if any of you are particularly interested in that aspect, then please do join us in the panel tomorrow morning at 9 a.m. But for now, let's get some answers from our panel to that question about, reusable and circular when it comes to medical and supply chain. Would anyone like to tackle that? Dr. Hannay?
Happy to kick us off and then hand over to others. So at FIND, we've kicked off an initiative on green diagnostics, because while we've done some rough, calculations on the carbon emissions from the diagnostics that have been, manufactured at least and disseminated at a global level, and it's modest compared to other areas. We think it is going to be more and more a significant issue as more and more testing happens, particularly the more and more rapid single-use tests, which then become a source of waste in communities. And so I think it's going to become particularly critical as we look at expanding from a testing base where most testing is done by central labs or just not done at all, to a setting where community health workers, where individuals in their homes are doing more testing, and that does generate some plastic waste. We're hoping to see more and more innovation in the manufacturing processes. So particularly around where do you use plastics within rapid tests, for example, and where can you use alternatives or less plastics in order to reduce that load. But perhaps the unseen part of the climate impact of manufacturing there is on the supply chain. So shipping these tests around substantial locations, they can often be bulky, even if they're not heavy, and that comes with significant carbon emission costs as well. And so innovations in the manufacturing process, particularly around moving that process closer to communities, is also one of those unseen ways that we've thought about to reduce medical waste and to reduce a little the impact that testing has on the environment.
Thank you, Dr. Hannay. Thank you for that question, Dr. Jody. Any more questions? Should we take one from this side of the room? There's a hand up at the back there. If we could get a microphone to that person. Thank you.
Hello, thank you. My name is Ivan Tarimo. I'm from a company called Bankable from the Tanzanian business community. My question's for Mr. Lin. As an expert within free zone areas, as the Madam President has said, pandemics happen, and with each pandemic, you want to be slightly better off in a response from the previous one. One thing that we are seeing, so Tanzania's location, for example, is strategically located as a hub within the sub-Saharan Africa space. The Medical Stores Department in Tanzania has a mandate to distribute medicine and supplies across sub-Saharan Africa. So it is strategically located to act as a hub in that specific area. So as per your experience, what are some of the strategic imperatives that we need to capitalize on to actualize this very clear opportunity to leverage Tanzania, its location, and the fact that it's a corridor to almost 7 or 8 landlocked countries around it? so that when the next pandemic hits, we already have capabilities as a free zone for manufacturing and distribution capability to serve that particular area. Thank you.
I think what you're maybe highlighting is what are the key, I suppose, key success factors to have a good regional hub for medical distribution and supply chain. I think at the base of it is infrastructure. You need to have good infrastructure that which makes it easy for you to attract top companies, whether we are talking about the logistics suppliers or the manufacturing or the diagnostic companies to set up. That's basic, and of course connectivity in terms of whether it's air or even to land transport or sea transport, and policies. I think one of the things which may have been overlooked is, I think, as for free zones, you have the capacity to act as both a manufacturing base by itself, as well as a transit hub for ready-made supplies to come in and move out to other locations with minimal fuss, and whereby you have you reduce the customs requirements as well. So for traders, for distributors, they'll be very much encouraged to set up in a free zone, because besides the incentives you have, the policies, the procedures will be more or less streamlined and automated. And of course, you need to, at the start, persuade to attract some anchor companies in each space. I think this is the basic success. So if the top 3PLs, the top medical companies in the relevant fields, and operate pretty much a hub and spoke approach. So you may have in Tanzania your main hub. It's ideal for long-term success to have on the receiving end some kind of tie-up, whether if it's a facility with a service provider, of course with the relevant governments, to make sure that the free flow of these supplies do not face any restrictions which are unrequired. I think this is something we faced very much during the COVID period, whereby new novel treatments came up, and of course a lot of these things, there are no protocols in place to enable these new treatments to enter the relevant places. I think these are some of the areas. Thanks.
Mr. Lim, thank you very much. Hope that has given you lots of food for thought and some very good advice there. Thank you. We have a hand up on this side of the room.
My name is Isra. I'm from Albania, and I'm coming from Northwestern University in Qatar. My question will be directed to Her Highness, but the other panelists can feel free to answer it. It's more of a general question, but as the first female president of the Republic of Tanzania, how would you say Tanzania has had a greater impact on female empowerment and as well as female education? And that could be linked also to the point that you raised about how the dependence of Tanzania is mainly because of the lack of technologies they have, and maybe the greater the education opportunities are there, it would also help on the gaining of independence or more independence. Yeah.
Yeah, maybe I should say the Tanzanian as a country on gender equity and gender development. Tanzania got independent in 1961, on the other side in 1964 in the islands, and it became the United Republic in 1964 April. And we had our first constitution as a union government in 1987. Yeah, the first. But then since then, within our constitution, we have a component of gender equality, the component of human rights, where gender has been identified as a necessary feature in running the country. So both men and women were getting equal rights on different arenas: voting, education, health, everything. So gender issue has been a main agenda within our constitution and implementation of our various development activities in the country. And that's why now we have people like me and maybe one generation before me, ladies, leading different sectors of the country. It's just fortunate now that we do have a lady president. But then having a lady president doesn't change much because these plans have been earlier imparted in our development plans. The 25 years Tanzania development vision, 25 years, but then we have different other plans. And all these plans are gender sensitive. So what I'm doing now is maybe to improve where we haven't done good, just improving, but then following the requirements of the Constitution. So the gap which is happening is due to so many factors, not only gender, what should I say, gender gaps or gender inequity, but it's because of other factors, just like other African countries. But for gender issues, gender equity, gender equality, we are trying hard. For example, in the, I'm getting away of health issues. In the jurisdiction, in the, how do you call it? Judiciary. In the judiciary, we have almost 47% judges in different type of courts are women. Then in the parliament, we are almost 36-38%. In the executive, 37-36%. And I'm trying to improve it, going to 50-50 in every sector. So we are trying hard on gender development and gender sensitive plans. Thank you very much.
Thank you very much, Your Excellency. Well, we only have a couple of minutes to go, so if we have one or two last questions. Yes, Professor Mohammed, here in the front.
Thank you. Do you hear me?
Yes.
Thank you. I'm Mahmoud Adel. I'm advisor to Her Excellency, Minister of Public Health here. My question to Her Excellency, I think you made a very pertinent point about self-dependence in everything. My question is, what about the thought leadership? We're talking about the health services challenges and problems. I spent and trained in the UK and I served and now recently moved to Qatar. What I found, when the health system get matured, they do have think tanks, for example, King's Fund in London and a number of others. You look at the other countries, you'll find any ideas, any plans in Africa to have those think tanks, because as you said, you have got medical school, you have got the same curriculum, but I think when the professionals come into the system, they have got excellent ideas, but they're trying to have a conducive environment. And I think we need to create those think tanks on those places so that they can create the local solutions and be the champions.
Yeah, fortunately in Africa we are working on regions. So I belong to two regions, East African region and SADC, Southern African Development Community as a region. And in both two regions we do have think tanks which are working on different issues to make our regions develop, to make our regions be able to cope with others. So we do have think tanks. We might vary between ours and the developed ones, but the good thing here is working together. If we can exchange ideas and experiences among the think tanks, then that's going to work. What we don't want is the think tanks to come and dictate to us on what is to be done, but we have to discuss and agree on what should be done in our areas, as opposed to imposing. So that's my
Thank you, Your Excellency.
explanation.
Thank you, Professor Mohammed, for that question. Let's take one final question from the audience here, if there are any. Would anyone like to ask the final question? Yes, gentleman in the white shirt.
My name is Suleiman Muhammad. My question is directed to my national mother, Excellency the President. I believe one thing, that there is no world without Africa. The whole world depends on Africa. And Africa, we have all the resources. Now that we waste a lot of potential brains coming to Europe, coming to America, how can we curb those brains and develop locally to benefit from them? Because in the next 5 years, we don't want to hear the same thing depending on the West. When they don't give us the medicine, we suffer most. But we can develop our own technology. They developed it, we can do it. So how is the government at the national level, how have they set the funds or the institutions to nurture these brains so that in the future we can benefit from them locally? Thank you.
Thank you for your question. So how do you stop the brain drain from Africa?
We do have ICT hubs, ICT incubators, and ICT trainings within the cities and outside the cities. And within these incubators, we are training our youth on various fields of innovation. And we do have very good innovators, of which some of them, they have come with the technology of which we are using in the country. But these innovators need to be the knowledge needs to be improved, need to be advanced. So this is what we are working on. But we have a lot of youth, very talented, innovating on various items, and they need to be advanced. The knowledge needs to be advanced. And this is what I'm working for. Thank you.
Thank you very much, Your Excellency. Well, that is all we've got time for. It's been a really interesting and dynamic 60 minutes or so. Very difficult to sum up, but if I can, I think there is a general consensus that solving the supply chain challenge is not only about responding to the challenges, but anticipating them, as well as absorbing the shocks of those challenges, and that to improve resilience, there needs to be more shared information, more shared technology, supplier visibility, decentralization, and in that way, we can try to bridge this gap in the supply chain. Thank you so much to our audience for their questions. Thanks so much to our esteemed panel, Her Excellency Samia Suluhu Hassan, President of Tanzania, Mr. Ling Menghui, CEO of Qatar Free Zones Authority, and Dr. Emma Hannay from FIND. Thank you, shukran.